All right, so we're Group 5's case study on PT ethics. Just to give you a quick background, John is a third year doctor of physical therapy student on his last clinical rotation. He's interested in geriatrics and is working on a long term care facility in the subacute care unit. John completed an initial examination on a 73-year-old man named Walt and determined that Walt would benefit from physical therapy, but has limited rehabilitation potential. Walt had difficulty during the 30-minute examination, but was assigned a very high RUG category, which means that he can receive a minimum of 120 minutes of physical therapy per day. John, the PT student, thought that this was an error, so he approached his clinical instructor, Wendy, and when he asked Wendy about the RUG, she said, "You know what? You need to talk to your our supervisor." So when talking about the RIPS model, we just want to go through um, just one at a time. So we're going to start with the realm. So in realm, we think that individuals. So we want to talk about Walt. And Walt is clearly affected because he's the one that's being treated, um, and he's the one that's not getting sufficient care. We just want to address that, you know, although John is the one facing the ethical dilemma, the main person that's being affected is actually Walt. We want to talk about the organizational or the institutional um, aspect of the realm, in which would be, in this case, the nursing home, the supervisor, the CI, so everyone involved in the organization. And, you know, they're obviously not doing their job at making good ethical decisions. When John went to go and talk to them to address the issue, they just told him like, this is how we do it, and ethical or not, it kind of seemed like they're just in it to make money. And we just kind of stepped back from all of it and looked at it from a societal view. And this could be a potential for a bigger problem. Like if Walt is one of the patients that are being affected at this nursing home, I mean, who else is being affected by it? So that's something that we want to keep in mind. Okay, now we want to move on to the individual process. Again, we're just looking at it through John's perspective. So we want to just go down from the sensitivity, judgment, motivation, and courage. John recognizes that there was a problem after he evaluated Walt and realized that Walt is not able to exercise 120 minutes a day. I mean, he could barely get through the initial eval. So John recognizes that. Now we want to move into judgment. John realizes that these are unrealistic interventions, and we need to cater to Walt's needs and not the clinic or the facilities. Again, we want to look at the moral motivation. Although John has no instant financial motivations, like the company does, John does have a lot to lose by addressing this problem to the hierarchy of command. John has to worry about his future career. He has to worry about his reputation. He has to worry about finishing his degree and his clinical rotation spot. I mean, these are things that John is putting on the line by continuing to address this ethical problem. And to complete this, we got to talk about the courage that John needs to talk about. He needs to have the courage to talk to the CI. He needs to have the courage to talk to the supervisor, and he does definitely need to talk to somebody if neither of them are addressing the problem. So the next thing we want to talk about is the ethical situation. In this situation, John is faced with a dilemma, and he has two choices. He can either do the right thing by following the company's policy, or he can do the right thing by doing what's right for the patient. Then we want to address distress. Being that John is only a student, he doesn't have the authority to really make that change. So he does need to go through that chain of command. But as we said earlier, he needs to have that courage to really implement any change. And we can definitely see that being a third year PT student, how difficult that might be. Temptations, there is definitely temptation for John. He can just try to follow the rules so he can potentially have a job with this clinical rotation site. He's worried about completing his degree. His reputation's on the line. Um, and he really just, I know as a third year PT student, he probably wants to make sure that he's networking correctly and he doesn't want to step on any toes. And silence. I think this just kind of goes along with the moral courage. He doesn't want to stay silent. He wants to speak out about it, but having that ability and having the um, access to professors or anyone really that has the authority to do something in this situation. So to reflect back on everything that we just talked about, the fact is John is faced with the problem. Walt's rug score is too high for his condition, and John wants to make sure that he is taking the appropriate steps for his patient. The major stakeholders in this is John, obviously, and also the company, because they're making the money, and really on a bigger scale, this isn't just affecting Walt. This is affecting other residents that are at this nursing home. And the consequence of this is, it's pretty serious. We have to look at insurance fraud, loss of licensure for the people that work there, not just PTs, but everyone. I mean, this fraud is a pretty serious thing, and putting all the laws and rules aside, we're really putting the patient at risk and not putting the patient first and their health. Um, so, what resources are available? Like we said earlier, as a PT student, we do have our professors as a resource, that we can talk to them. If our CIs or the supervisor at the facilities we're doing our rotation sites are not helpful, we can definitely contact the local authorities, such as your local ombudsman, which are officials appointed to investigate individual complaints in nursing homes and places like that. So that's something to really keep in mind. So what is the right thing to do? And the right thing to do is definitely make sure that you know we aren't thinking about ourselves. We are looking at um, patient care, and we're doing what is best for the patient, and that we're not taking advantage of the system and just you know really insurance fraud.